Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got part 4 on our series on neutral spine. We're going to be talking about how to fine-tune your neutral spine in your lower back to help prevent your pains while training and help to provide a healing stimulus for your back with all your lower back healing exercises. Hope you enjoy. So in parts 1 through 3 on neutral spine, our videos in the series, we talked about how to position your neutral spine in various planes of motion, such as pelvic tilting, lateral flexion of the thoracic spine or the rib cage, rotation of the pelvis and the rib cage, integrating muscular contractions such as RPI, reverse posture isometrics of the multifidus, the transverse abdominis, the obliques, and we used also in one of the sections body sway to determine what sway position we fall into naturally when we're on one leg or with our eyes closed and balanced, and how body sway can affect pain, and how to put your position of your lower back into your exact neutral spine alignment with the appropriate muscle tensions to hold it there, so that while you're exercising, while you're doing your healing exercises for your lower back, your spine is in the center position away from the ranges of motion and the types of abnormal muscular contractions that cause pain. But today what we're going to talk about is once we set that neutral spine, how to fine-tune it. And a perfect example just came in last week. One of our subscribers came down from Canada to check his RPI with me, and we use this fine-tuning method with him as I do with many of my patients. And that fine-tuning method is using muscular tightness, abnormal muscular tightness, to determine the exact position and which parts of your RPI or alignment are most important. So for instance, if you go to your lower back and feel in the area that you have your pain, you can use any position or any location that you want to, but typically if you go about an inch off the sides of the spine on both sides where the facet joints are, many times an abnormally working facet joint or spinal joint that's having tightness, it's having hypomobility or joint fixation, will have local tightness in that area. And this is what we used the other day. And if you determine that that tight area is right around the area that you feel a lot of pain, you're going to move through various alignment corrections, and you can determine which alignment correction works the best in reducing that tightness under your finger. The actual muscle tightness will ease when you get the right amount of tension. So for instance, let's say for example you suffer from pronated feet, where one heel likes to lean in more than another, or you have an externally rotated leg, and perhaps you have a little side tilt tendency. We have a tendency because you sit with postural habits to lean to one side, and because you work on the computer all day, you have a forward head posture. And these are the various alignment issues that you found on your body analysis. Again, if you haven't yet done so, go to either the Pain Free and Fit website or the Posture Size website. We have a free body analysis there for you to check your alignment, to figure out what are your alignment issues so you can help put yourself into a proper neutral spine position. So what you're going to determine with this muscle tension is which of those factors plays a more critical role or a priority versus the other factors. If I can monitor that muscle tension with my finger and then start correcting some of these problems. If my right leg likes to turn out in a normal standing position, I'm going to monitor that muscle tension and see if turning that leg in starts to change the tension under my finger. If it does, I'm going to make note of that. If I typically have a forward head posture, I'm going to pull my head back and see if that, at a certain position, starts to change that tension under my finger. If I have a tendency to lean my torso to one side, I'm going to lean away. Now, you already have an idea of what to do based on those other 3 videos in determining your neutral spine, but we're going to fine-tune because we're going to say, of these, let's say, 3 corrections, correcting my leg from turning in, correcting my head from going forward, and correcting my body from leaning to the side, I may not know what sequence or how much exactly of each of those to do. So I could do a little experiment where I say, does the tension under my thumb change or ease more if I put my leg in first or if I pull my head back first? Or does it change when I lean my ribs to the side first? And I could then say, if I pull my foot in first, then my head back second, and my rib lean last, does that best ease the tension? Or if I reverse that, rib lean first, head back second, leg in last. Is there a difference? And many times the sequence of how you stack those various alignment corrections is going to show you under your finger which position changes that muscle tension the most. You may even have a pronated foot, which we had with that subscriber that came in the other day, where he noticed that because he had nerve irritation going down his legs from a piriformis syndrome and from IVF stenosis on both sides due to a degenerative condition in his spine, he noticed that when he put his legs straight and he started leaning more towards the outside of his heels to prevent foot pronation, that the leg symptoms settled down. So sometimes it's not only the muscular tension that's going to make a difference, but it's also going to be the symptoms. If you're having acute lower back pain right now and you put your finger around the area, not only does pulling the head back first versus tail under second make a difference, but also possibly turning that foot so that you're leaning a little more towards the outer part of the heel and not pronating that heel inwards relieves the pain. So you want to use a fine-tuning approach where it's a matter of what sequence and how much of an alignment correction. You may only need a millimeter to the left or right. That little millimeter makes all the difference in the tension under your thumb or the pain that you're feeling in your lower back. Use this in terms of once you set your RPI and your neutral spine from the last 3 videos, use this procedure of muscle tension and or pain to try to figure out what fine-tuning, what sequence of stacking my various corrections is needed and how much of each correction is needed to, one, not only reduce pain, but also change the actual protective muscle tension under your finger. It's going to help you to lock your spine into that neutral spine position so you can maintain that while you're doing your planks, while you're doing your bird dogs, while you're doing your Bulgarians. Any other healing exercise that you're doing for degenerative discs, for spondylolisthesis, for facet syndrome, for ligamentous hypertrophy, for lumbar stenosis, whatever your condition, your RPI or neutral spine position fine-tuned is going to be your best bet in strengthening your body to hold that position, to reduce the mechanical stresses that irritate your lower back, and promote a better stimulus with your workouts for healing your pain and protecting you from future injury. If you like this video and like to learn more, feel free to subscribe to our channel. We've got a lot of great videos out there on lower back rehab exercises. If you'd like to help me share this vital information with others, give me a thumbs up. Questions or comments, please write in. You always see the next idea for my videos. If I can do anything to help explain or take care of your unique case, let me know. Contact me through the painfreeandfit.com website. We can get together on a video conferencing call and I can check your postural alignment, help you determine where you need to go with your exercises. If you're looking for a great tailored exercise program, check out painfreeandfit.com. We've got a great healing program for lower back pain. We've got specific diagnosis, specific healing exercises, a fast-track program for spondylolisthesis, another one for degenerative disc, and a new one that just came out last month for facet syndrome. Check this out. Use your RPI, use your neutral spine position, and fine-tune it. I hope that this particular series on fine-tuning RPI and neutral spine helps you with your chronic lower back pain.